Hi, I'm Mike Conti, Chief of Vascular Surgery at UCSF Medical Center and co-chair of the recently published Global Vascular Guidelines on the Management of Chronic Limb-Threatening Ischemia. These guidelines highlight the importance of individualized clinical decision-making based on the assessment of patient risk, limb severity, and anatomic pattern of disease, acronymed as PLAN. Today, I'm pleased to announce that to facilitate the translation of these guidelines to clinical practice, the SVS is now providing 3 new mobile apps on its interactive practice guideline platform. These apps allow for the real-time estimation of patient risk, severity of limb threat, and anatomic complexity of disease for revascularization. The calculators are simple to use and are meant for everyday practice settings. The VQI CLTI mortality prediction model uses baseline demographic, comorbidity, ambulatory status, and medication data to estimate 30-day and 2-year patient survival. Risk groups are summarized as low, medium, or high based on these estimated values. The SVS Threatened Limb Classification, or Wi-Fi calculator, uses the consensus scheme for estimating risk of major amputation that has been validated across multiple institutional studies and registries. Wound, ischemia, and infection are each graded on a 0 to 3 scale, and the combination of grades is grouped into 4 clinical stages based on estimated 1-year risk for major amputation. Wi-Fi staging is recommended for all CLTI patients at initial presentation over time to monitor response to treatment or disease progression. Finally, the Global Limb Anatomic Staging System calculator allows the treating vascular specialist to estimate the overall complexity of arterial occlusive disease in the limb at risk from an angiogram. The treating physician first decides on the preferred target artery path, or TAP, which is the primary below-knee vessel being targeted for inline flow for the case at hand. Grades are defined for the above-knee and below-knee segments based on lesion location, length, and severity. These grades are then combined into 3 overall glass stages for the limb that are expected to correlate with immediate technical success and 1-year patency for an endovascular intervention. The SVS and the Global Vascular Guidelines are excited to offer these new tools to the vascular community and all practicing vascular specialists who care for patients with CLTI. Broad dissemination and use of these calculators will increase the quality of patient and provider discussions, provide opportunity for validation and future refinement of these tools, and promote evidence-based care for our patients. Thank you.